Good afternoon, and welcome to our second in a series of conversation with community leaders. I'm Teresa Harvey, President and CEO of North Orange County Chamber of Commerce. Today we are privileged to have as our guest Adam Loeser. He is the Fire Chief for the Fullerton Brea Fire Department. As we begin our conversation, I remind you that if you have questions, please add them to the Q&A box or chat, and I will do my best to facilitate your inquiries. If you're on Facebook Live, we're monitoring those as well, so don't feel like you're going to be left out. Adam became the chief of the Fullerton Fire Department in December of 2018. I'm making him really old here. You can tell it's been a long day. He formerly served as Deputy Chief of Operations for the Brea and Fullerton Fire Departments and served in that capacity since 2015. He is a member of the Consolidated Command Staff, which manages 10 fire stations covering 35 miles. Together, both departments have 20,000 calls of service annually. He has a degree in political science from the University of Hawaii and is a California State Chief Officer qualified. He's also completed and participated in North Orange County Chamber's leadership program. Welcome, Chief Loeser.
Thank you, Teresa, for having me.
No, absolutely. So 35 square miles and 20,000 calls annually sounds like an enormous task. What's the fire department's current staffing levels and deployment configuration based upon our size of our population and cities served?
So that statistic with the 35 square miles and the 20,000 calls, that's for both the cities of Fullerton and Brea. So just parceling off what the city of Brea, what we respond to with its 22 square miles and 144,000 nighttime population, we'll call it. We responded last year to just over 13,000 total calls. In comparison, in 2010, we responded to just over 10,000 calls. So we've had a significant increase just over the last 10 years in calls for service. And that's due to various things, right? The city is expanding. The population is getting older. There was a change in the way healthcare is administered through the Affordable Care Act, was also enacted during that time period. So there are a lot of different aspects to why those increases occurred. We do deliver an all-hazard, all-risk service to the citizens of Fullerton, meaning that whatever your emergency is, which may vary from person to person, we come out and we tackle it and solve it. So that can be medical related, it can be a car accident, it can be a collapsed trench from construction, it can be a house fire, it can be hazardous materials spill. So it runs the gamut of what we are, what we respond to and what we're required as far as job knowledge. And we take that very seriously. And all of our members are trained up to provide that level of service that over the last 112 years, 100 plus years, the citizens have expected and our members carry out with pride.
How many firefighters, command staff are on the two police fire force, and are there additional openings that could be filled if the proper staff was available?
So with the command staff, kind of going back to a little bit your first question too. So the command staff was enacted in 2011 by my predecessor, Wolfgang Knabe. And that was at the time coming off the heels of the last recession, ways to look at and capture some efficiencies and obviously some cost savings. So by taking the command staffs of the Brea Fire Department and the Fullerton Fire Department, and through attrition and some openings, overlapping them so there's just one command staff, you obviously are eliminating some of the higher executive level positions of an organization. That's where the bulk of the savings came from. And now we are responsible to oversee 2 individual fire departments. Currently, we have myself as the fire chief. I have 2 deputy chiefs. I have 2 division chiefs, and then I have 3 battalion chiefs, along with someone who handles our EMS or our medical services. And that's what makes up our shared command staff. So we save in excess of $1.2 million per year between the 2 cities. With the cost sharing, it's roughly a little over $700,000 for the city of Fullerton annually. And so right now, so that's the command staff. And I know for some people that may be somewhat confusing, but you just look at it as I just oversee 2 individual departments. That's it. As far as openings on the Fullerton Fire Department, we are currently down 6 positions, 6 firefighter positions. We have had a huge challenge over the last 5 years of retaining our firefighters. And, you know, predominantly it is due to the dollars and cents. We've been struggling to make sure our personnel are compensated, but at the end of the day, our neighbors around us are just paying a better wage, and it's very difficult for me to keep our people here. People come to Fullerton as firefighters because it has a diverse call volume. We're planes, trains, automobiles. So we got obviously all the major railroad spur that goes through the city. We have the airport. We have the freeways that we're surrounded by. We have some wildland that's within our city. We have commercial, residential, business. We have a major hospital in our city. So a fantastic city to work for, especially if you are a firefighter trying to really have some experience. So it's not from an organizational sense that members are leaving. It's just from that. And we've been trying to do what we can as a command staff to make that organizational parts I have control over the best it can be for our members. And but really at the end of the day, I want to train my people and I want them to stay here. I don't want to train them and then have one of my neighbors take them from me. So that is one of our challenges that we're trying to deal with right now.
Well, I think that's a challenge that businesses have, and one that Fullerton is certainly facing in many departments. So how does the department size compare to other communities so far as numbers of our population and the numbers of employees that the fire department has?
So a good measure, I guess, or most appropriate measure would probably be the city of Orange. Very like in population. They might be a little bit bigger as far as acreage or square miles, but they have a number more of personnel more than our department. Due to some different measures about 2.5 years ago, we did remove an engine out of service. And we took those people from that apparatus and added them to other fire engines, so that all 6 units, and we have 6 stations. We have 1 apparatus at each of the 6 stations. Each of them now have 4 people on them. Out of those 6, 5 are paramedic engines, meaning they have at least 2 paramedics on that apparatus. And those are the engines that respond if you have a cardiac issue, a respiratory issue, a diabetic issue, where you're going to require advanced treatment. The 6th apparatus is our ladder truck. And those of you that are listening or watching, that's our big long ladder truck where there's a person in the back, the tiller person, that has the long aerial ladder. And that has 4 people on it as well, but they do not have paramedics on them. That is one of our specialty pieces of equipment. And so when we went from 7 pieces of equipment to 6, that kind of threw us off kilter a little bit, as far as trying to have each of our districts, we have 6 districts, covered equally. So it's not that our 6th district, which is at Station 6 up off of Rosecrans, is hazardous. It just does not have paramedics in its district. It's surrounded by paramedics that can get there in the appropriate time. But as far as housing paramedics, similar to the other 5 districts, it currently does not. It's not staffed that way, and that's one of the challenges we're looking for in the future, is to get back to having equal service to each of the districts, and on top of that, our specialty piece of equipment, the ladder truck, to service the entire city appropriately.
So this leads me to my next question. I know we partner with Care Ambulance for medical transport. How are emergency services delivered to the residents of Fullerton?
So with that, I know when you call 911, if you're not in the business like I am, you call and you expect, if you have a medical aid, you expect probably an ambulance and someone to take care of you. And if a fire engine shows up, okay. But a lot of people don't understand why a fire engine shows up, and an ambulance. And what I mentioned in the beginning of the broadcast was we're an all-hazard fire department, fire-based fire department. So that means that fire engine with 4 people can respond to anything. And one of those anythings is medical aids. So I liken it to a Swiss Army knife or a rolling toolbox. Whatever the call is, you open up the doors, you're going to either get the knowledge or you're going to get the actual tools to solve the problem. So when you dial 911 for a medical aid, you'll get 2 things. You'll get a fire engine that has the 2 paramedics on it, and you'll get an ambulance. And the ambulance is through a private contract we have with Care Ambulance. They've been our partner for a number of years, at least a decade plus. They provide the transport piece. So our paramedics, they will do the treatment to the patient, providing the care that is needed, and then they will take the patient on the ambulance and transport them to the appropriate hospital. Some instances, since we do have the 2 paramedics, if a patient is stable after we've treated them, then only 1 paramedic would go in the ambulance, and that ambulance would take the patient with that 1 paramedic to the hospital. That remaining other paramedic would remain on scene with the rest of the crew for a total of 3, and they would go back in service. So if another call came down, 3 streets down, they now are available to respond to that patient and provide them medical care as well. So that's how service is delivered. That also ties into when we made that change from 7 pieces of equipment to 6, we went to 4 people on each apparatus. And that is a benefit that we saw from putting 4 people on each piece of equipment, is now we have a 2-for-1 model that makes us more efficient. It also reduces response times as far as how fast we're able to get to you as the citizens.
So as our community ages, have you seen the need for emergency services and or fire increase over the last 5 years, or has it remained fairly constant?
No, our fires have incrementally increased just because we are an older city. So north part of the county tends to have more fires just because of the density, the age of the buildings, the lack of sprinklers because of the age of the buildings. So we have seen those incrementally increase. Essentially last year we went on a little over 355 fires for the calendar year. So about a fire a day in some form or capacity. But definitely a rise on the medical aids. And again, it goes back to the factors I mentioned earlier, but and they're all over the place as far as what we go on. And in different parts of our city, we have different challenges. So our downtown station 1, they run kind of a variety of calls. Station 2 over on our west side, they have the airport, and a lot of their calls they go on are medical aids in that area. Station 3 on the east side, on the south of Commonwealth on Acacia, that's in our industrial area. There are some apartment complexes that are within their first 2 areas. So they run a combination of hazardous materials type calls and then some medical aids. Station 4 up on Harbor and Hermosa, that's in our residential area. So they're and they're by the hospital and some of the care facilities that we have in our city. So they predominantly run medical aids. Our Station 5 over by the college, they run on a lot of medical aids because there's a ton of apartment complexes that are in that area due to the college, and they do run on a lot of burnt toast. And then our Station 6 over off of Rosecrans, same thing, another more residential area, but they do have the Coyote Hills area that is behind them that we saw last year. We had the Castlewood fire that was a fantastic stop by the fire department and the neighboring agencies. We kept that to just over 10 acres during some really severe conditions here. So we have that we contend with, but that's kind of how the calls lay out. And that's something that most fire agencies have been noticing is the increase in overall call volume.
So whether it's a fire or a medical emergency, quick response is critical. And I know something that as a citizen, I would certainly want to know that if I called 911 for a medical emergency or a fire, that someone would be here quick. What is the average time to get there? And at the same time, do our roads and the condition of our roads impact the response time for the fire department?
So the answer to your first question is 5 minutes. So, and the reason for 5 minutes is for two parts of the equation, our two primary missions, which is medical and fire. So the more time that goes by for a serious, say, cardiac event, we say time is heart muscle. So based upon American Heart Association guidelines and various studies, we get a unit there within 5 minutes to begin treatment. As far as it relates to fires, every minute that goes by, the curve for fire to expand and grow increases, which thus decreases survivability for not only residents or occupants, but also for damage to the home. So the sooner we get to a fire, the greater chance we have to help out occupants and reduce damage, therefore help people get right back to their normal life. The sooner we get to people who have medical emergencies, the greater impact we can provide as far as getting them back on a rail of normalcy, and more importantly, getting them to making that bridge from their current situation to the hospital where they may need immediate care by a physician. So 5 minutes is our goal. And I forget the last part of your question.
Well, I was asking, what can we do to decrease response times? And more importantly, does the condition of our roads slow down the response time?
So unfortunately, the increase in the amount of calls we've had, our big trucks probably haven't haven't improved the roads. But the roads definitely, in some areas, they definitely slow down how we are able to respond. But the biggest part that decreases our response times is going to be just more personnel on more units. That's really the primary way that you look at to decrease that. Now, as the fire chief, that's my job, is to look at it holistically and see if there's different ways to provide the service that can get what units we have currently to the calling party faster. If there's a different way for them to travel on, whether it's a different type of a piece of equipment, I look at that. I'm also looking at using a program that helps me identify with our 6 stations where they're located at. Based upon call history, I can look at response times to those areas, and then I can play with moving stations to see if that increases or decreases response times to better serve the community. So my overall goal is to have the lowest response times possible, equal service for the entire city, and then do it at the most cost-effective manner possible to retain my workforce.
That's great. So I have a couple of questions that have come in from the chat before we get going on some of the other questions that I have. One was, tell me about mutual aid and with the fires up north, if Fullerton is participating at all. And how you mentioned in Coyote Hills that you had assistance from other agencies. That would be another example of mutual aid. So how does it work both on a local and a statewide basis?
So yeah, great question. So the fires are very serious up north. They're having a little bit of it going down right now with the weather conditions, but essentially extreme temperatures, red flag conditions, what we know here as Santa Ana conditions, and then on top of that, several lightning storms. So with the lightning storms, that's what's spread the fires out of a large geographical area, and that's what's causing or has caused a lot of the devastation that's up there. So in California, we have a master mutual aid agreement, and basically all the fire departments agree to help one another for an incident that is too big for them to handle on their own. So what the intent is that if there's a fire somewhere else, we will send what we can up to that area. The state will compensate or cover for the use of those units in a manner that doesn't make money and we don't lose money. It's trying to get it as close to possible as cost neutral. The idea is that eventually that city, those region, will have the benefit of the resources coming from the opposite way, thus the term mutual. So we have 2 fire engines and 8 people that are up north right now. We have 2 of our chief officers that are leading a strike team of engines. And a strike team means 5 fire engines that are the same. So those are 2 strike teams that are from Orange County fire departments, 2 of those being ours. And then we have 2 single resources that are out there, and those are firefighters who are wildland paramedics. So they're providing the medical care to the firefighters that are out there as they're working the long days. And the guys, I just talked to them yesterday, and they're working 48 plus hours nonstop and having maybe, if they're lucky, 12 to 24 hours off just because they are so low on personnel and resources. They have brought in resources from Oregon, Washington, Nevada to help augment what we have right now. So some pretty serious conditions up there. So keep them kind of in your thoughts. And if you have any family or friends up there, try to reach out to them and see if there's anything they need. Fortunately for us right now, Orange County and San Diego counties, we're in a bit of a humid bubble. So we're feeling what we liken to Florida weather or Midwest weather, with the humidity being higher than normal, which is fantastic for us because it keeps our fire danger low. And we have not had any Santa Ana conditions as of late. We are expecting those to roll through this area in October, and currently have the resources still in Orange County to tackle any problem that may pop up here. As far as locally, though, for mutual aid, the difference between really aid with one another, there's automatic aid and there's mutual aid. And automatic aid really stems from the idea that you have like number of resources, quantity, and then you also have similar or like services. So when you have that level playing field, if you have calls or needs for service along borders, you can get together with another agency that borders you and agree to send a like resource or like resources across the border with no questions asked, inconsequential of what the patch says. Whereas mutual aid is saying, well, maybe there's not the number of resources that's not there, or the service levels aren't the same. And so by doing that, that is a request for service So we say that if there's a request for a medical aid along our border, you can still make the request for that to our department, and more than likely we will send a resource to that medical call or that fire or whatever it may be. But it also gives discretion to the home agency who sends that, because at that time there may be something major going on in their city that at that particular time they cannot afford to give up a unit to another city. So in the short event, that's your differences between the mutual aid and the auto aid system. As a rule of thumb, it is an incredible system that California is very proud of, and it does not happen like that in all parts of the United States. We've worked very hard on that since the early 70s, since the firestorms up in Malibu. And the current fire chiefs and even my predecessors have put a lot of effort in place to make sure that remains strong, so that all of our citizens feel they have coverage, and at some point the cavalry will come.
That's great. My other question that came in has to do with fireworks, particularly illegal fireworks. And I think we all saw a spike of activity this year since the city didn't have its sanctioned fireworks display. Tell us a little bit about the issue with fireworks and how it impacts the department, and whether you've seen a rise or a decrease in both legal and illegal fireworks and the fires started therein over years.
So fireworks are a tricky thing, not only for us, but for everybody in Orange County. For us, safe and sane fireworks are legal. And that was enacted, I want to say 2014, don't quote me on that, a handful of years ago. And based upon that, and we typically have our city show, which is fantastic. But unfortunately, due to COVID this year, we did not have that. And so more people were obviously at home. And just by the way it was, we did notice a number of illegal fireworks that were up in the sky. And so, but I say that tongue in cheek, as I looked around from, the borders, all the other cities, and it was the same show going on in their cities as well. Now, the numbers of fires or incidents that we had have gradually increased, but really the calls for service impact our police department and our fire department as far as trying to figure out where the problem is coming from. But the challenge with fireworks is once they've been identified, they're in the air, you're already too late. So we are looking to make a change for next year within our fire prevention division, and that is to address enforcement. And we've already really made a big leap in our educational part. You might have noticed the digital signs that were out this year and last year. When we do, the one measure we take with our fireworks vendors is that when they sell fireworks, they have to give a document that's from the fire department explaining the differences between safe and sane and illegal fireworks, and reinforcing that they are illegals can come with a fine. So we've tried to do as much public outreach and education as possible. But at the end of the day, it comes down to being able to enforce that to keep our citizens safe. And so we'll be working with our fire prevention division. We'll be working with the building department and our police department as well to come up with a better solution to kind of tackle that, so that everybody can still enjoy the holiday just in a safer manner.
That's great. Well, it's very clear that fire and emergency services are dangerous occupations. Certainly as a community, we thank all of you for your service. All of our lives are better because of the work that is being done by you and your team. So how do we evaluate and mitigate safety risks associated with this profession, and how can we better provide these services?
So, my job, another part of my job is I'm a risk manager. So it's very important to me to make sure that my personnel are trained, they have the proper equipment, they have the most current equipment, that they are riding on the safest equipment and the appropriate equipment, and they have all the support needed to do their job out there. Because at the end of the day, I'm a customer service rep. Obviously, I serve the citizens of Fullerton, but I also serve, and equally, I serve my firefighters. They're the ones delivering the service. So part of my job is to make sure that that they have to reduce injury, and to make sure they're on the job and can fulfill a full career injury-free as possible. And then equally as important is that when they do retire from the job, that they can enjoy their life post fire department. So an important piece that a program we implemented within this last year is with the turnouts. So turnouts is the yellow firefighting gear that the men and women wear when they go into a fire. It's fire resistant. It has multi-layers. It's very high technology-wise, but at the end of the day, it is a material that can burn and can absorb and hold on carcinogens. So we moved recently to a service that not only cleans them and documents the cleaning and gives them a thorough analysis as of their status on that particular day, and adds that to a database to allow us to track those turnouts. But it also allows us to make sure that we're in compliance with a national standard, so that when those turnouts, we generally have them for 10 years, but there may be times due to the number of fires that the members respond to, that those need to go out after 7 or 8 years. And so now we have a service that not only keeps our members in clean turnouts more often than not, but it also has documentation, so we know when to pull those out and to replace those. Those turnouts, just as a side note, are about $3,000. So the cost to outfit a firefighter is, by the time they're all said and done and walking out for a fire with their helmet, their jacket, their breather, their backpack breather on, their mask, their pants, their boots, their gloves, an axe, we're looking at about $7,500 to $8,500 worth of gear. So you put fire or EMS on anything, the cost goes up, but it has a lot of standards that it has to abide by, again, to keep our men and women safe. So as far as risk management, that's one measure that we've been able to take to reduce that risk. But the overarching idea is to definitely make sure that the equipment and training is there to support them so they can do their job safely.
I never thought about what it would take to actually send somebody out with that equipment on. You mentioned, though, not only men in your department, but men and women. Talk a little bit about the challenges of having women in the department. This is certainly a non-traditional career, but one that I think is probably going to be increasingly popular for women as we end up with advancements in equal rights and with women advancing in untraditional careers.
No, for sure. And, you know, my outlook as the fire chief is I don't care what color you are, what sex you are, whatever. I need to make sure that you can do the job. And so we are fortunate. We have 2 women on the job. Fantastic. They're both captains. They were both college athletes. And we're very proud of what they do for the citizens. We have various ethnicities that work for our department. They bring Korean speaking, Spanish speaking. So we have a diverse group for our city, but definitely one of the challenges as far as men and women are concerned is just the accommodations. Because we are a 24-hour, 7 days a week, 365 operation, men and women are accommodated together. And although we have policies and procedures to guide the members on what they are to do and not to do, at the end, there still has to be facilities that accommodate both sexes. And for some of our stations that are older, most of our stations were built in the early to mid 50s. That is a big challenge for us as well. Our smallest station, and probably our station that we're looking to focus on the most, our Station 2 over on Brookhurst in Valencia, it quite frankly is busting at the seams, and the ADA and the gender compliance is a very big challenge for us. So as we move forward, as far as updating or maintaining our stations, it's also looking to make sure that they can accommodate the changing workforce, and along with that, the change of the apparatus. So the apparatus of the 60s, 70s, and even 80s, the fire engines were as long as a lot of the full-size, heavy-duty pickup trucks that are driving down the road today. Whereas the newest fire engine that we just put into service last year at Station 5 is in excess of 35 feet and about 15 feet tall. So they've definitely gotten taller, wide, longer to accommodate more stuff. And so as we try to, again, move the working board and identify if there's any better ways to deliver the service, we're constrained by the buildings we have right now. And that's another challenge that we are looking to address as far as a plan in place to make modifications and to update those city buildings.
So as far as those types of capital investments, where does money for those types of things come from? If you have to build a new fire station, if you say you were down a truck, if you have to replace a truck, and how is the city dealing with this?
So one of the biggest investments for a fire department and thus for a city is our fire apparatus. Our fire engines, they cost about $750,000. They are a custom-made fire engine, and so they carry a heavy price tag. The ladder truck, like I said, with the person driving in the back, those are between $1.2 and $1.5 million. So definitely forecasting, budgeting, planning for those large expenses is probably one of the largest and the most important actions we can take as a department and as a city. And so the fire department is funded primarily from the general fund. Public safety in general is general fund dependent. Unfortunately, we are an expensive insurance policy, and we have done some different ways. The command staff is one to try to offset some of the cost and find ways to reduce that to make sure that full service remains intact. But it is expensive to run the fire department. As far as the stations, they run anywhere from a typical station from $6 to $8 million. And so depending on the property, if you own it, it can escalate, or it can maybe go down a little bit. But the fire apparatus and the stations are big ticket items. The stations can be done, most cities do them as a bond measure. But at the very least, they have to be planned out. It's not something you could just drop in the council's lap and say we need a new fire station. There has to be a lot of planning and forecasting to go on to that, so that just like any city building, it's either being refreshed or it's being evaluated and determined if it needs to be scraped and replaced to address current and future needs. And that's kind of where we're at with the fire department with their buildings. Is we're outstripping the needs of the service based upon just the growth and the change of the fire service in general.
Yeah, it's remarkable, all of the moving parts. I can imagine if you were redoing a fire station that you'd have to have some type of duplicative coverage, so that while that station is out of being remodeled, that there were still operations going on. And it's just an incredible puzzle that you put together. So once again, we really thank you for all that you're doing for our community. Adam, it's great to have gotten to know you while you participated in our leadership program, and we salute you for what you're doing now as you lead these two major departments in Orange County. So once again, thank you for you. Please extend our thanks to your staff. Is there anything you would like to say in closing?
Yes, please. No, I enjoyed my time with the leadership program that the Chamber put on. I met a lot of fantastic people who I still see, whether it's on social media or at city council meetings or just in the community. Fantastic program. I thank you for letting me be a part of that. I just wanted to, reiterate, I guess, what the elephant in the room is also is that we are still in the midst of this pandemic. Your firefighters are responding to your calls as you need us to. We are taking the proper precautions to keep us safe so that we can respond to you in a safe manner and not put you at any more risk. On the other end of the spectrum, as far as the hospitals are concerned, they are taking the same measures. So my suggestion to those of you that are listening, please, if you have a medical emergency or emergency at all, do not be afraid to call us. Do not be afraid to go to the hospital and be treated. We have seen people who have been very hesitant to call or to go to the hospital for issues outside of COVID. And I just want to really make sure that feel confident in your fire department, in your EMS service. Precautions have been taken, and you will safely be taken care of both where you're calling your call for service and then at the hospital. Please continue to wear your masks. Please continue to wash your hands. If you're sick, stay home. All those basic things that we've heard over the last, I guess we're going on 6 months here. Take them seriously so that we could get back to some normalcy, open up back our businesses, get our kids back in school, and put this in the rearview mirror. As much as I have a family as well, and this has definitely impacted my family, no different than anybody who's listening on here. But we all need to just be responsible, and we will get past this. So thank you again for having me on. If there's any other questions that you have for me, you can always contact me, or our information is on the city website under the fire department. I have an email address and a phone number that's on there. And I appreciate everybody's support. Thank you for having me on again, Teresa.
Absolutely. And thank you again for all that you do. I think it's very important, as Adam says, to make sure we all continue to follow the social distancing guidelines, wear your masks. Orange County is off the watch list for now, but it needs to stay off for a couple weeks before we can even consider the governor's possible allowing us to go back to some sense of normality. Next week, we are honored to have Chief Dunn from the Fullerton Police Department as our guest on the program. So please come in and tune in next Thursday for another continuing program of conversations with our community leaders. Again, thank you, Adam, for all of you, all that you've done for us, and for all of you out there, mask up, stay healthy, and check out the Fullerton Fire Department and the city's website for more information. So thank you so much, all of you, for being a part of this today, and let us know if you have any additional questions. You can certainly email me at tharvey@nocchamber.com, or give us a call on our phone, which is 714-871-3100. We're working to man the office as we can, but your calls will always be answered as they're forwarded to either me or my staff on their cell phones. So give us a call if you need us. Thank you so much, and we'll see you again next week.
Bye now.